You're a brave man.
Thank
Keep
you.
fighting.
Thank you.
I believe I speak for everyone in the room when we say, keep fighting, man. Keep fighting. You've done so well, and we certainly hope you'll keep fighting.
Thank you.
And finally conquer this. Thank you. And thank you for sharing your story as well. It's educative for a lot of people right here and at home who are watching us right now. Thank you. Thank you for that.
Thank you.
And we'll come back to you for a little bit more in terms of insights. Beatrice, you've heard him. He's talking about the economic. Talk to us a little bit about what he said. Now, the numbers of it, the economic impact on families, and are there any policy gaps that actually worsen, the impact on people like Derek and their families?
Okay, thank you very much. But let me disrupt. You see what he has talked about, what our lady here from the county, what Dr. has said, what Reverend has said. All these are the fruits of a healthcare system that is not functional. So now, as an economist, I'm going to discuss the root cause. And this is what we call in economics the social determinants of health. These are non-medical factors that can actually affect your health outcome. Before you see Dr. Kimutai, you've walked a journey because you don't live in the hospital. And I usually say, just like the father of medicine called Hippocrates says, let thy food be thy medicine. It is our kitchens that makes us healthy. Before I see Dr. Kimutai, it starts from my kitchen. But as governments and as policymakers, what are the 7 factors of the social determinants of health? The first one is economic stability. The reason why he'll fundraise is because most likely he's a young person, unemployed, no job, no work. So when a condition affects him, he cannot access healthcare or cannot even be tested earlier enough. Because why? He doesn't even have the funds. Now you talked about SHA. SHA itself will ask you to pay premiums. Okay? And they're telling the youth, I remember there was a policy that had introduced that every young person who is unemployed must contribute 1,000 shillings. From where? That's what the youth asked them. From where? Because for me to pay the premiums, I need to have a salary, I need to have an income. But yet 60% of the youth in this country do not have jobs. So obviously with economic instability, what will they eat for food? They'll eat chips and sausage fried in what oil, kind of oil? Transformer oils that we walk on the streets of Nairobi. And the person who is producing those chips using transformer oil also has economic issues. And that you are saying the reason why we are dying young is because of economic and policy issues.
Okay.
So, number 2. We look at education access. The same young people with the same government, they've been told the economic funding model for the education system is no longer there. So what happens? So anybody is going to access education because this is where you get informed. You're able to be able to analyze situations. You're able to have the analytic mind. You are not able to actually access it. Number 3, we have the built environment, or what you call our environment. For example, when you look at Nairobi right now, when you go to Kilimani, skyrocketing buildings, high-rise, the affordable housing that you're actually looking at, there are apartments. So where are the playgrounds? When she come and talk about mental health, where do we have nature walks? When they build our roads, remember most of our young people are using borders, right? So where are they going to cycle? I want to cycle. When they build the roads, yes, it's true, it's infrastructure. Where are the pedestrian walks? So when you look at, we have not even talked about accidents, the number of accidents that young people are dying at an early age. When you look at play parks, for example, the Kenya Forest Service recently added fees charges. So if I want to go to the park to actually relieve myself mentally, where do I have access to these parks? So when you look at our built environment, look at the houses they are building. They are building bedsitters. Do you know what is a bedsitter? Already you cannot even breathe, you cannot even discuss. I was expecting for affordable house care, there should be 2 bedrooms, apartments, and above. But they're giving us bedsitters. You know, you can imagine how psychologically it affects you. I know I'm not an architect, but I think there was a recent research that actually stated that when you live in very constrained environment, you know, when you call it minimalistic, it starts encroaching on your psychology. The next thing is mental health. The next thing you want to kill yourself. The next you can't breathe properly. How are our landlords? These are the policy issues. How are landlords building our houses? Do they have enough windows? Some landlords, you only have one small window, which is also the door. Are you imagining that's how they're building those buildings? Right. So that definitely is going to impact your health. Number 3, we look at access of healthcare in its essence. So in this access of healthcare, when you come and say you're going to do universal healthcare coverage, how are you ensuring the 60% of the young people who are unemployed, they can actually get the premiums they deserve to actually be in that SHA? Now, recently, I think it's Mama Lucy Kibaki, a young woman who was miscarriaging, goes for an emergency care, but she's now being detained because of 6,000 shillings. And yet the CEO of that Mama Lucy Kibaki wants her to produce 6. From where? You know, will she go plant from trees? Now, last but not least, look at the governance and the policies. So when you look, for example, let me to cut it short. For example, when we look at healthcare, we think it's only one department called healthcare. But let me tell you, healthcare cuts across. If, for example, the person who owns this media station does not do occupational health safety, all of you will be having broken legs. So it means there must be a policy about occupational health. Now, if it's the farmer who is farming there in Meru, for example, there are high cases of cancer in Meru. Why? Because the nutritional value of the soil that the farmer actually plants the soil, it's already eroded. So it means in the agricultural ministry, I'm expecting what is the health policy in that agricultural ministry. Let's come all the way even to the education sector. What are the healthcare educational programs within our curriculum that can actually teach our young children to actually know, I need to eat vitamin A, vitamin B, I need to protect myself, because preventive is what Africa can do. Curative is damn expensive. Recently, in the year 2018 to 2019, actually, the government on non-communicable diseases spent around 50.6 billion. That's a huge amount. Yet the same government, when it's going to budget for preventive healthcare, only sets aside 11 million. Are you seeing how diabolical that is? Now, when you look at mental health cases, when you look at the budget, it's 0.01%. Yet, most of the young people are being affected mentally each day in, day out. You don't have a job, you live in a bedsitter with one small single window, okay? Look at it. And on top of that, you could be having an ailing mother, an ailing grandmother back at home because they cannot access healthcare, they cannot access nutritional food. The soil is already eroded. It can no longer produce crops. So the factors are so deep that unless we deal with the root cause, whatever all these people are discussing are just the fruit cause. And most likely, our survivor here, Derek here, could actually, if he walks through the journey, most likely, he was exposed by maybe Derek, you love eating fish, most likely, right?
I used to.
You used to, exactly. And you will realize that Mama Karai, the oil she's using are the seed oils. Yeah, the research has shown the same seed oils that are being accumulated within our body systems are the ones introducing these non-communicable diseases, bringing this cancer on board. So if that mama fish or the fishmonger, if she's able to be educated, the correct oils to use, maybe he would have fed on a very good, healthy fish, contributing to his healthcare system. Maybe if she is funded very well, she's a teacher teaching in class, she's telling people, boil your water, wash your hands, the soil, how do you test its nutritional value? Then it means even if I do not become a doctor or I don't become an engineer, I become a farmer, the kind of tomato reaching your doorsteps will actually be a nutritional one. And obviously, you may not actually need to visit that doctor.
Right. I think we just need a moment to digest all this. Thank you. Thank you. It's quite a sweeping explanation here, which gives us just how interconnected everything